Hello, my name is Tim Gaffney. I'm from Arizona. I'm a patient, Dr. Matthew Kaufman's. In October of 23, I noticed that I instantly could not lay down flat, or I stopped breathing. I couldn't bend over, or I stopped breathing. If I twisted, like to reach something in the backseat of my vehicle, I'd stop breathing. I was constantly tired. And then when I did go to sleep, I had difficulty sleeping, shortness of breath, had low oxygen levels. I had gastrointestinal issues where I was going to see specialists for that. I dealt with a lot of bloating issues and stomach pain. Those are pretty much what my signs were. Back in 2006, I received a brachial plexus injury. I was put into traction improperly. And then my life progressed from there. I was able to deal with that. October of 23, I had rotator cuff surgery on my right shoulder. And it came on instantly after that because they did a nerve block. And they went through my brachial plexus and into the phrenic nerve. And so when I came out of surgery, in that surgery, they had to sit me up to try and recover my oxygen. I wound up in the surgery center the entire day as they were trying to get my O2 levels back up. And all of those symptoms pretty much started at that point. We spent almost a year trying to get this diagnosed. I originally went to a heart doctor. Heart doctor said it's not your heart, it's your lungs. Went to a pulmonologist. Pulmonologist says, no, it's your heart. Went back to heart doctor. He said, no, it wasn't. Ran some additional tests, diagnosed me as possibly having heart failure. Sent me back to pulmonology, said it's your lungs. Pulmonologist, I had ENG tests done, and they said that it's in my spine. And I was just misdiagnosed for the entire time until finally Barrows Neurological. I actually had a neurologist there who actually did my ENG test. And she said, yes, I have basically diaphragm paralysis and phrenic nerve paralysis. She sent me to the thoracic surgeon at Barrows. And he said, well, I could do the surgery to put in a pacemaker on your diaphragm, but I don't know if it's going to work or not. There's not enough evidence here. So then they sent me to another plastic surgeon there at Barrows. And he said he had not done any types of surgeries on these, but was going to research with the top neurologist there to try and figure it out. We wound up getting a call just a few days later where he said that the risk is too high to do anything for the fact that I can be put on a ventilator if it goes wrong, that this is basically just something I have to live with. So we left the doctor that day. I was devastated. My wife and I are pretty much in tears thinking this is what my life is going to be like for the rest, for the rest of my life. We wound up calling a friend of ours who does medical research, and we're just talking to her about it. And a short time later, she sent us a link to Dr. Kaufman and Dr. Jarrahy. And so we wound up reaching out to them. We contacted almost every one of the doctors we've been seeing and asked them, can you please refer us, to Dr. Kaufman? He's amazing. Look at these stories. And sure enough, within a couple days, Dr. Kaufman's office reached out to us, asked to see all of my testing that I'd had done. It took my wife quite a bit of time to gather it all together and send it to him. And then we got amazing news that Dr. Kaufman agreed to do a conference call with us, and I believe it was September. And he basically put us at ease when he talked to us. He's an amazing, compassionate man. Here I thought my life was pretty much over. When Dr. Kaufman, he explained to us it's safe to do, and took a ton of time, showed compassion, explained everything, answered every question we had. We never felt rushed with him, and we just felt amazing. And he told me that somebody would be reaching out from his office to schedule the surgery. So we flew in on October 22nd to New Jersey, and then we had another ENG test done the following day. Then we met with Dr. Kaufman and his staff in his office. Once again, it was amazing to meet with him and his staff. They all sat down, explained everything to us, explained to us what the surgery was going to be like, exactly what he was going to do, what the recovery would be like. And then on that Friday, I went in for surgery. When I went in for surgery, I was super excited, but obviously a lot of anxiety. When you get in there, it's kind of intimidating looking at how many people are going to be involved, but I was very fortunate because I had both Dr. Kaufman, who came in and put me at ease. Dr. Jarrahy actually came there for my surgery. The thoracic surgeon, Dr. Bauer, was amazing. The anesthesiologist everybody sat there and explained the role, what was going to happen. Everyone put me at ease, and it was a long surgery, but I'm so happy. The hospital was great. Staff was great. My recovery took a few days getting up my oxygen levels, but then when I was released, today's exactly 2 weeks post-surgery. I've seen tons of improvement already. It's absolutely worth it. Like the spirometer before my surgery, I was only able to hit like 750 milliliters. I'm 2 weeks post-surgery, I'm hitting over 2,000. I breathe better, I sleep better, I can bend over now. I know that I'm just going to continue to improve. He basically saved my life because I looked at what my life was going to be prior to this surgery, and I just, I was basically given, like a death sentence, but knowing that this was my life. I used to be active, going to the gym 6-7 days a week. I was super active, going hunting, hiking, doing things of that nature, and everything in my life had stopped. And now, thanks to Dr. Kaufman, I know I'm going to get all that stuff back in my life. I've just got to follow through with exactly what he said, and I know I'm going to get better.